Hello everyone, my name is Munir Nikhan, lecturer, Faculty of Nursing, Assam Downtown University. So today I'm going to discuss the important topic under mood disorder. It is manic episode. So before discussing manic episode, let us know what is mood disorder. So mood disorders is conditions which affect our emotional state. So this mood disorder is classified into manic episode, depressive episode, bipolar affective disorder, persistent mood disorder, and recurrent depressive disorder. Now let us see the further slides. So manic episode is characterized by elated mood, an increase in quantity and sleep of physical and mental activity. Now, in manic episode will, as we know, there is a disturbance of mood and affect. So let us know what is mood and what is affect. Mood, it is a pervasive and sustained emotions that colors the person perception of the world. Affect, it is a short-lived emotions and can be defined as patient present emotional responsiveness. Now coming to the manic episode, as I have already told, manic episode is characterized by elated mood. There will be increase in quantity and speed of physical as well as mental activities. Now, the lifetime risk of manic episode is about 0.8 to 1%. The disorder tend to last usually 3 to 4 months, followed by complete clinical recovery. Manic episodes significantly disrupt the occupational and social activities. So we can see there is an increased psychomotor activity ranging from overactiveness and restlessness. The activities are usually goal-directed based on external clues. Now coming to the classification, this classification is according to ICD-10 classification. Manic episode is classified as F30.0 hypomania, F30.1 mania without psychotic symptoms, F30.2 mania with psychotic symptoms, F30.8 other manic episode, F30.9 manic episode unspecified. Coming to the etiology, in neurotransmitter and structural hypothesis, it indicates that there is an increased level of norepinephrine and dopamine. There is deficiency in serotonin and imbalance between adrenergic and non-adrenergic systems. Now, biological finding also suggests that there is a lesion in the right hemisphere or bilateral subcorticals, and there is a lesion seen in the periventricular gray matter. Coming to the genetic consideration, monozygotic twins or identical twins have a higher rate of incidence than normal siblings and other close relatives. And siblings and close relatives have higher incidence than general population. The first degree relative have 10% chances, and identical twins with bipolar disorder about 40 to 70% of chances of having manic episode. Coming to the psychodynamic theory, in psychodynamic theory, it hypothesized that manic episodes are responsible mainly as a result of faulty family dynamic during early lifehood and defense mechanism or defense or denial of depression. Coming to the psychopathology of mania, we can see there is a lack of inhibition, apparent quickness of psychological reaction, easy distractibility. There will be flight of ideas where the individual will be speaking or there will be abrupt change from one topic to another using external cues. There will be elation of mood with general well-being and lack of insight. The severity of the manic episode is classified as state 1, state 2, state 3, and state 4. State 1 indicate euphoria, state 2 elation, state 3 exaltation, and stage 4 ecstasy. This stage 1 is also known as euphoria or mild elevation of mood. Stage 2, that is exaltation, is moderate elevation of mood. Exaltation, there will be severe elevation of mood, and ecstasy, there will be very severe elevation of. Now, euphoria, it is the increased sense of psychological well-being, not in keeping with ongoing event. Elation, moderate elevation of mood with increased psychomotor activity. Exaltation, intense elevation of mood with delusion of grandeur. Ecstasy, severe elevation of mood, intense sense of rapture or blissfulness seen in delirious or stuporous mania. Now coming to other clinical features, we can see increased psychomotor activity, overactiveness, restlessness to manic excitement. Coming to the speech and thought, the person will have flight of ideas, there will be pressure of speech. The person will be using clang association, where clang association means that the person will be using playful language like rhyming, joking, or teasing with delusion of grandeur or delusion of grandiosity with inflated self-esteem, delusion of persecution. So mainly the delusion of persecution is secondary to delusion of grandeur. For example, I am so great that people are against me. The person will be using the statement like, I am so great that people are against me. And next is distractibility, where the individual will get easily distracted from the environment, external stimuli. There will be increased sociability, impulsive behavior, high-risk activities, poor judgment, decreased need of sleep, decreased food intake due to overactivity, decreased attention and concentration, and absence of insight. Diagnosis can be made on ICD-10, ICD-11, DSM-5. Psychological tests such as Young Mania Rating Scale can be used, and diagnosis can be also done based on the signs and symptoms. Coming to the treatment modalities, we have various treatment modalities like pharmacotherapy, psychosocial treatment, and electroconvulsive therapy. Coming to the pharmacotherapy, lithium has traditionally been the drug of choice for the treatment of manic episode as well as for prevention of further episode in bipolar disorder. Other medications like carbamazepine, sodium valproate can be used. Next, coming to the psychosocial intervention, it mainly focuses on the family and marital therapy, where it focuses on decreasing the interfamiliar, interpersonal conflicts and difficulties to reduce the stress or to modify the stress. And psychosocial intervention also focuses on continuity of treatment and adequate drug compliances. Next is ECT, electroconvulsive therapy. It is used for acute manic excitement if not adequately responding to antipsychotic and lithium. Coming to the nursing diagnosis, we can formulate nursing diagnosis based on the patient condition. The first one is risks for injury related to disease process as evidenced by extreme hyperactivity, increased agitation, and lack of control over purposeless and potentially injurious movement. For which intervention we can give maintaining low level of stimuli in client environment, stimulus like low lighting, having few people around, low noise level, removing all the dangerous objects from the client environment so that in his or her agitated, confused state, the client may not use them to harm self or others. Close observation is necessary so that intervention can occur if required to ensure client safety. Offer empathetic response to the client feeling and maintain a calm attitude towards the client. If client is not calmed by talking down or by medication, use mechanical restraint. Next, nursing diagnosis, insomnia related to disease process has evidenced by difficulty falling asleep and sleeping only short duration. Interventions monitor sleep pattern, provide a structured schedule of activities that include established time for nap or rest. Clients should avoid intake of caffeinated drinks before bedtime, provide nursing measures that promote sleep, such as back rub, warm bath, warm, non-stimulating drink, soft music, and relaxation exercises. Administer sedative medication as ordered. Next nursing diagnosis is impaired social interaction related to delusional thoughts or thought process, which is delusion of grandeur or grandiosity or persecution. Intervention recognize the purpose of manipulative behavior served for the client, self-limit on manipulative behavior, do not argue, bargain, or try to reason with the client, provide positive reinforcement for non-manipulative behavior, explore feeling, and help the client seek more appropriate ways of dealing with them, help the client recognize that he or she must accept the consequences of own behavior and refrain from attributing them to others. Help the client to identify positive aspect about self, recognize accomplishment, and feel good about them. With this, I would like to conclude my topic. Thank you.